Hello everyone, good evening and welcome to the latest Tiny Tickers webinar. Thank you for joining us this evening. We're focused on the topic of siblings tonight. So we've got loads of information, as you can already see on screen. We've got loads of panelists who are going to be talking to you about this subject. So whilst everyone's joining us, whilst we're making sure you get your audio set up and all that sort of stuff, I should just go through some of the introductions. So this is the fourth webinar in our series of family support webinars. The other three are all available on our website already. We did one on supporting parental mental health and well-being, one on travel and holidays, taking your child on holiday, and one on starting school and nursery. So if you didn't see those and they're relevant to you and you'd like to watch them, they're all available on our website now. The video of this webinar will also be on our website within the next couple of days. So if you have to leave before the end and you want to watch any of it again, then you'll be able to follow that link and watch it all back. I just want to give a big thank you to any of you who donated when you signed up. We really appreciate that. All of the support is most welcome as a small charity. And we should also give a shout out to Global Make Some Noise, which is the funders for this webinar series, and also for a number of our other support projects as well. And this really fits into sort of a menu of support that we offer families with CHD. So if you haven't already, you could join our Facebook groups, you could go on our website and read all the family stories, watch videos. We can send booklets out, all that sort of thing. So please do have a look through our social media, have a look through our website if there's other ways that we can support you as well. Just saw a message flash up there from Vicky. Vicky is one of the Tiny Tickers team. She'll be in the chat all night. So if you want to jump into the chat, introduce yourself, say hello, let us know a little bit about your circumstance, your children, where you're joining us from, that sort of thing, then please do feel free to do so. Also keep an eye on the chat because Vicky's going to be putting loads of links and useful information in there over the course of the webinar as well. I always make a note of this at the start. We're not IT experts, so something might go wrong with the technology. Hopefully it won't, but please do bear with us. If you have problems and you're kicked out of the webinar, you should just be able to follow the same link that you have come in on to get back in. But if you can't for whatever reason, don't panic. As we said, there will be a video of there as well. I'm John Arnold. I am lucky enough to be the Chief Executive of Tiny Tickers. I'm also a heart parent. I've got a daughter, Zoe, who's soon to be 18, who was born with an AVSD and had heart surgery when she was 3 weeks old. In terms of this topic tonight, she has got two brothers. They were both subsequent to Zoe, so we didn't have to go through the process that we'll be talking about tonight of explaining to little children that their new brother or sister might have a heart condition, but it's certainly been a huge thing in the boys' lives as they've grown up as well. So I have some parental experience of that respect. Just whizzing around the rest of our panelists, we've got Jill McBurney, who is a cardiac nurse specialist at Alderhay, and we've got Lorna O'Brien, who is a senior health play specialist also at Alderhay, and we've got Dr. Rachel Alison, who's a principal clinical psychologist in the paediatric psychology service at the Leeds General Infirmary. So three experts who are going to talk to us about this subject, all with a vast wealth of experience of helping families affected by congenital heart disease. So each of those three are going to come in and do a little talk for you. We're going to start off though with a video chat that some of the members of the Tiny Tickers team put together. We've got lots of people within our staff team who have lived experience of this topic. So we've got about a 15-minute video for you to watch just to kick off and introduce the subject, which was recorded a few days ago. Whilst you're watching that video, whilst you're listening to any of the talks, if you'd like to, then please do pop any questions for any of our panelists into the Q&A. There's a Q&A box that you should be able to access. Pop any questions in there and we'll do our best to answer them at the end of the session. So right, I'm just going to navigate my way to the video of the Tiny Tickers team. So it was Louise, Gaynor and Nicola, who are three of the staff members at the team who got together to talk about this. They've all got slightly different experiences of siblings and heart conditions. And here it is. Okay, so I shall come back to you. Enjoy listening to this. I should give you a little warning. It's an emotional listen. So just to let you know, it is obviously a tricky subject and there are some points in this that are a little bit emotional. So just to tell you that before we start.
Hello everybody, welcome to our sibling support webinar. I'm joined today by the lovely Gaynor and Nicola. So we all have our own heart heroes and other children. I have my heart hero Emmy, who has transposition of the great arteries She is now 2 years old, and she has two older sisters, Sophia, who is 8, and Aria, who is 4. So at the time when Emmy was born, Sophia was 6 and Aria was 2. And I found out about Emmy's condition when I was just 13 weeks pregnant. So Emmy's heart was the size of a grain of rice at the time, which still amazes me. But we're very grateful to have found out so early on. So Nicola, did you want to introduce yourself?
Hi, I'm Nicola. I have 2 daughters, and my youngest daughter, Isabella, was born with a heart condition, coarctation of the aorta, and needed emergency surgery. So we had an emergency transfer, and her big sister, Amelia, was 2.5 at the time when she was born, and we didn't know anything about it. So it was all news to the whole family.
Yeah, I can imagine that was incredibly difficult. Gaynor, did you want to introduce yourself?
Hi, I'm Gaynor. I am mum to Joel, who is my heart hero. Joel was born with critical aortic stenosis and he has multiple heart defects. Joel has an older brother, Lucas, who had just turned 4 when Joel had arrived. We didn't know anything about it either. It was a massive shock to us that all 4 of us were in the room when Joel's heart condition was detected. So we were all in shock and in a whirlwind together trying to process the news. And the boys have formed an incredible bond, and Lucas turned out to be the best sibling ever that Joel could have ever had. He's just been wonderful all the way throughout it. We've been very lucky through what's been the most traumatic experience of our whole lives.
Yeah, I can imagine. Okay, so I feel like the first topic we should discuss is parents' guilt. So I know that a lot of parents feel guilt whether they're heart parents or have heart healthy children. I know it's something that I really struggled with when Emmy was born, particularly with being apart from the girls. So Emmy was in hospital for just under 3 weeks, and we were very fortunate in the fact that my parents could stay at home with the older girls. So they were able to do like normal activities, go to school. So it was at the end of the summer holidays, so they actually went back to school while we were in hospital, which was also quite tough. But we had accommodation at the hospital, so it was very hard being away from the girls, but they did come to visit. But I do feel like parent guilt, it is really tough, but it is very natural. And actually, I think it just shows like what a good parent you are, because you're just caring about all of your children. So Gaynor, did you want to?
Yeah, so when Joel was born, Lucas had just turned 4, and for that 4 years, I'd worked part-time. He'd been my little sidekick throughout. It'd always been me and him, our own little team. We used to have so many adventures. We had a lovely time all the time, and he was just so excited about becoming a big brother and for his new baby to arrive. And Joel arrived on the 16th of July, literally at the start of the summer holidays, and just as Lucas had finished at nursery, and Lucas was about to start school in September. So it basically all happened on the same day. Lucas left nursery, Joel arrived, everything just went disastrously wrong. And like we say, the guilt is just incredible, because straight away when we thought we were bringing home our new baby, Lucas and his dad were there ready to take us home, and instead of bringing us home, Tony had to take him away, leave us at the hospital. My best friend had to come and collect him and spend the night with him. He's still traumatized by her cooking that night. And the wrench from leaving him and feeling like we'd abandoned him was horrific. We had weeks in hospital. Joel wasn't expected to live initially, and he had surgery at 2 days old, and that was very touch and go. And the whole time that we were with Joel, all I could think was that Lucas at home, wondering where we were, wondering what was going on, just wanted to be with us. And I knew he was with the best people, being with my best friend and our parents when they could. And if you speak to Lucas, he'll say, "It's absolutely fine, Mum, you did what you could, and I totally understand that, and there's no need for guilt, and you were absolutely brilliant." And he'll defend us to the end, like, "You couldn't have done any more, Mum." But it's still there. And I don't think it leaves you.
No, yeah,
I
I
think
agree.
it's fine to feel like that as well. I think that's normal and it's fine. And it's just part of the journey that you're on.
Yeah, absolutely. How about you, Nicola?
So Amelia was 2.5, just over. So the same. She'd just been my little buddy the whole time. We'd spent, 24 hours a day together since she was born, really. And all of a sudden I had to leave her. There was no goodbye. There was no, I couldn't tell her. I couldn't explain. I just had to up and go and be with her baby sister. We were in hospital for 2 weeks. We were quite away from home, like an hour and a half away. So although we had accommodation up there, it wasn't really right for Amelia to be there, in PICU, and it's very traumatic, isn't it? You're trying to kind of cope yourself as a parent, and then you've got this added stress of worrying about this, your other child, and feeling like you completely abandoned them, which is the worst feeling in the world, because as much as you talk to them and try and, get them to understand, they're little, they can't take it all on. They don't really know. All they know is mummy and daddy aren't there, and it's really hard.
I tried so hard. It was the focus of my life. Do not let Lucas feel neglected or overshadowed or sidelined or anything. It was the driving thing. I had to do all of these things for Joel, but I needed Lucas to just know how loved and treasured he was, and he was just as important as he'd ever been.
I had great support from my family as well. So I had my parents looking after the girls, helping me with whatever they needed, helping me when I got back with Emmy, and I was trying to navigate having 3 kids and having a poorly child. So yeah, I'm really grateful for that support. How did you actually tell your other children about your child's heart condition?
So there was no actual, we've had this baby and it's just not well. It was just like a whirlwind in front of us. It just happened. There was no time to process it or to think about the best way to tell him. It just occurred. And it was only then when we brought him home and he went straight back into heart failure and everything went wrong that we had to kind of like pave the way for. We're not sure if he's going to live, and everyone's doing the best they can for us to keep him. And that was start of quite a few of those conversations. Just there was no planned discussion. It just happened in front of him, unfortunately.
What about you, Nicola?
I don't really remember having a specific conversation, if I'm honest, with Amelia about, it was like a bit of an emergency thing. Isabella was 8 weeks old by the time she was diagnosed. So we'd been at home, like kind of living life with 2. And all of a sudden her baby sister was whisked away with her mum and dad. And it was huge for her, I'm sure. It was really hard, but I think we've always talked to her about everything. We've all, tried to keep it an open discussion, like it's not a secret in our house. Like we talk about all the checkups and we talk about all the tests that Isabella will have done, or talk about things that we need to look out for. She's always been included. We try and make it at the right level.
My story is a bit different. So obviously with finding out early, I actually held off telling the girls at first, just while we got our head around things, had some more scans and appointments. So when I told them, I actually had to tell them that we were having a baby as well. So I feel like that actually helped, because obviously they were really excited to have another sibling. And I also knew the gender of the baby. So when I told them, I'd bought one of those confetti cannons, and Ollie didn't even know either. So I videoed them doing the cannon. So that was really special. But then afterwards I did say to them, your baby sister is going to be really poorly when she's born. But the doctors are going to take special care of her and they're going to fix her heart. I did want to be honest with them, but also talk to them like on their level. And actually, the girls were really resilient. They handled it really well. Does anyone have any tips on how to support heart siblings?
I think Nicola and I have had the same kind of approach for both of our children. I think we've both said honesty all the way through and keep it at their level. Just keep talking to them, keep the conversation open. Don't make anything a secret. In our house, it's exactly the same. Joel was born with heart defects. Joel's had 2 lots of surgery. This is a situation we all know about. It's very normal. This is just who we are now as a family. It's not the normality that we envisaged when we had our 2 boys, but it is our normal, and we're all good with that. That's just how it is. As they grow up, you can change the conversation and be led by their questions, and find a way to keep your special time with your other children special, despite everything that's going on.
It's important just to validate how your children are feeling, like letting them discuss with you and letting them know that it's okay to feel that way, and it's normal to feel that way, and just reassuring them in that way as well. How about you, Nicola?
Yeah, I totally agree with everything you've both said. It's normalizing everything, isn't it, and keeping the communication open. Something we did do when Isabella got to sort of quite a difficult before they can really understand why they're having their checkup and why they need to lie still and have an echo. Is we took Amelia to one of her checkups and we got Amelia to show her, like, lie on the bed, this is what you need to do. And then because a big sister did it, she would then do it as well.
That's such a good idea.
It's so brilliant.
It was really sweet. So then, she would always copy her big sister and she always wanted to be doing the same thing. But Amelia was she's always been an amazing big sister. She's very protective of Isabella. She wants to make sure she's okay, and she'll check in on her, and she'll ask questions and she'll think about it, and she's protective of her, and I think that's it's a lovely bond, because obviously it could go a completely different way, couldn't it? And it could be really hard for a sibling. They could feel completely excluded and feel really jealous of that time with their parents. So I feel really lucky that she embraced it and really took on her role of being an amazing big sister, which I'm truly grateful for.
It makes such a difference, doesn't it? Because Lucas always came to Joel's appointments whenever he could. He was always involved, and Joel absolutely hates having ECGs to this day. His spine having them construct to him. He's got such an issue with it. And if Lucas can come now, he still will come, and he'll just stand there and take the mick out of him. And but when he was younger, when Lucas had just started working, I think he was 14, so Joel had been about 10. And Lucas once came to the hospital and he's like, well, you're waiting to be seen. I'm just going to go and have a wander around Leeds. And I was like, oh, okay. I'm thinking, oh my God, he's 14 going into Leeds on his own. But what he actually did is he went into Leeds and he went to the body shop and he bought Joel some of his favourite Satsuma bubbles. So that when he'd finished his appointment, he got a little treat at the end of it. And it just showed how much he loves him and how much he thinks about what can make him happy and how caring he is. And it is just so lovely. But that involvement, like you've just said, for Amelia showing her little sister what to do and how to behave, I think that's absolutely brilliant. I think every heart parent should know that.
Yeah, definitely. Yeah, I feel like there's so many positives as well to them having their siblings to look after them and support them, and you're all in it together.
Absolutely.
Yeah.
Well, thank you very much. It's been lovely to speak with you both.
Thank you.
Thank you.
Thank you.
There we go. So I think hopefully that was a really interesting way of kicking off the discussion tonight. Lots of different experiences there, but some common themes, and a couple of the things that were said there really resonated with me and invalidated experience I've had. And I'm sure it's the same for some of you watching this evening. The things I particularly reflected on were that concept of parental guilt. I'm sure that's something that is very common and we'll talk about as the evening goes on. Also, the fact that this is just your new normal as a family, and that affects all of you. That affects the siblings as well, and that's what you have to deal with. And what Nicola was saying about the Amelia joining in the scans, that was certainly our case with Zoe, that once her brothers were a certain age, in preparation for the scans, their teddies themselves, they would all be lying on the sofa getting pretend scans to help Zoe with her appointment. So I'm sure there's some really common themes that everyone can see there. So I'm going to ask Lorna to come back in now, because she's now going to talk to us from the play therapist perspective. It's fantastic. I can see that Lorna started sharing her screen already. And as we mentioned, just whilst Lorna's setting up and turning the camera back on and all that sort of stuff, the chat is open. Vicky's already put some really useful information in there. If you do want to jump in and just say who you are, where you're from, and say hello, then please do feel free to. And in the meantime, I shall hand over to Lorna. Thank you very much.
Thank you, John. So as John just said, hello everybody, and I'm play specialist from Alder Hey Children's Hospital, and I work on the cardiology department, and I've been there for 16 years. As a play specialist, my role is to help children in hospital cope with treatment, prepare them for procedures and surgery. So this might be something that when you go into the hospital, you might end up getting a play specialist involved with your heart child. But also part of our role as well is to support parents and support siblings too. So it might differ as well. So it's important to just check with your hospital kind of what support is there and where the play specialists are and whether they can help. So yeah, as I said, play specialists can support siblings and parents, and we can do that by explaining to the siblings what's happening or having a chat with them. Or also what we can also do as well is just offer some advice to the parents if they want to be able to sit and spend some time with the sibling. So when a child is in hospital, it affects everybody, but especially the siblings, because what you often find is they've got to deal with lots of changes going on in the hospital, in their routine. So sometimes they might be staying in grandparents, they might be away from home. It could be that they're staying in their own house, but grandparents or aunties and uncles are looking after them. And especially as well, because they're probably spending a lot of time away from yourselves as well. So it's just thinking about what can help them through this. Right. John, I'm a little bit stuck. I'm trying to get onto the next slide. Oh, there you go. Right, there we go.
I can see that.
Sorry, technology. So you might see some changes in your child's behaviour, and this is quite normal to be able to see some of these things, but it's knowing how you can help to kind of prevent this as well. So some of the things you might find are sadness, and it could be things that they're upset because their little brother and sister's in hospital. It could be that they're away from the parents, and it could just be general sadness about things that are just happening to them. They could be a little bit worried about their brother and sister, and it could be even little things like as well that they're worried his mum and dad's going to be in hospital forever. So it's just kind of helping to undo them worries. And other things that you might find is like the jealousy, the resentment and guilt. And it might be just because obviously the baby's getting a bit more attention than them, and also guilt, little things like they might have been a little bit bad with their behavior and think that this has happened because of something that they've done. So it's kind of just trying to help to reassure them. The biggest issue that we come across as play specialists is normally the fear of the unknown. This is with patients and also with siblings, and sometimes parents as well. You'll often find that, if you don't know what's going to happen, it can make you feel a little bit worried and anxious. So children, sometimes they can't express how they're feeling, and they're a little bit worried about asking questions and things as well. So it's kind of just being there to be able to explain things to them. And also they might have misconceptions as well, because sometimes they might have been to hospital themselves. They might have had a little bit of a bad experience in the hospital, so they're worried that that's going to happen to their brother and sister. It could be that they might have had a family member that's been in the hospital that's been really poorly. So it's having little things like that in mind as well, so that we can reassure them and tell them what's happening. And obviously this is all because they don't know what's happening and why. So some of the things that we can do to help, and the best ways to help, is like what was said in the video just before. It's being honest and communicating with children. I think we take for granted sometimes like how clever some children are, and that they need that information to help them cope with things. And sometimes it's not giving them lots and lots of information to overload them, but it's just giving them the information that they'll understand. So I've just done a little bit of a breakdown. So if for infants and toddlers, it could be using toy doctor sets and a doll to kind of role play little things that might be happening in the hospital. And it's things like this that if you know that you're going to have a baby with a heart condition, it's something that you might be able to do before you actually have the baby, so you can get them used to seeing this equipment. And storybooks are great to use with children as well. So you've got Rosie is Red and Violet's Blue, and there's lots of other storybooks out there too. And for the likes of preschool children, again, using storybooks, you've got Rosie is Red and Violet's Blue again. You've got the Tiny Ticker's new baby book, which I know Jill's going to expand on in a little bit. And then sometimes it's just giving them a basic explanation about what's going to happen. So it might be explaining that baby's in hospital, and if they're going in to visit, it could be things like explaining what's going to happen, show them a photo of the baby, and it might be that baby's got, I'll just use for an example, a feeding tube. So it's just kind of explaining that they've got a feeding tube, and it's to help them feed and take their bottle. And it could be that you can get play specialists involved with things like this, and it could be that if the sibling is really worried about things like the tubes and things, we could maybe get a tube to put on their doll, and they can pretend to kind of feed their baby just like you're feeding your baby. And then things for older children as well is kind of, they'll want more of an explanation, they'll want factual information. So using the same example as a feeding tube, it could be things like they've got the feeding tube to help them to put on a little bit of weight, and then it's kind of giving them that story of, if they put on weight, then it might mean that they can come home, or it might mean that they can have the surgery, so that they can then have the surgery and then come home. And again, if it's talking about surgery and things, we've got lots of other books out there, like Sammy's heart operation and Jessica's heart operation, that you can find online that can help you to be able to talk to your child about that. So then other things that will help as well. So like before, they said in the video, it's to reassure them, to sit down and to talk to them, and to reassure them that it's okay to feel sad. And maybe little things like, you're not going to be staying in the hospital forever. And it's important to get the children to ask questions. And it might be sometimes that you're trying to do that and they just won't open up, and that's where you can kind of get play specialists involved and other health professionals in the hospital as well, to maybe sit down and talk to them, because sometimes siblings kind of pick up on a lot on parents thinking, oh, they're anxious, I don't want to cause any more worry, I don't want to upset them by asking questions. So sometimes by getting a play specialist involved, we can go in and we can have a little chat with them, answer any questions they've got, maybe we can probe them, see if that we can get anything out of them, and just build that little relationship with them as well, so that they've got someone that they can talk to. And again, one of the things that is really good is to keep with daily routines. Children love boundaries and routine. So where possible, I know it's not always possible, but it could be that they stay in grandparents or aunties and uncles, but they still can go to school and they can still see the friends and keep up with their social life. if possible. I know it's not always, but visits to the hospital can be really good as well. And it might be that you just do a little bit of preparation before that visit to the hospital. So what are they going to say? You could take pictures to show them of where the baby's room or the hospital, or pictures of the baby as well, so they can see that tube on their face and things like that, just to kind of undo that fear of the unknown as well. And things like buying gifts for the new siblings, so that could be done before the baby's born, because you might be busy then in hospital and won't be able to take them, or it could be a relative that could take them to the shop to buy something. Could be a little teddy that they can put into the incubator, or it could even be things like drawing pictures. It could be a photograph of them that they want to put in the incubator with their new baby, or it could be drawing a picture to put in the incubator, maybe on the wall in the room, or even making like a little sign on the door with their name on to go on the cubicle door. And again, if you can take them into the hospital, kind of involve them in the care. And I know sometimes that's not always possible, but even just little things like kind of helping them, for them to go and get a nappy for you, or just little things like that, that make them feel a little bit important. And again, like I said before, talking to them about how they're feeling and reassuring them that it's okay to feel that way, and that mummies and daddies might be feeling exactly the same way as they do. And it's just normalizing that for them as well. And it's a good idea to have some activities as well. So if you know you're going to be preparing your hospital bag, to have some little activities in the bag, just in case play specialists aren't around and there's nothing around in the hospital, so that when you are coming in for visits with them, sometimes it can be a little bit boring. It might be that they come in to visit and then a doctor or a surgeon comes to speak to you. It could be that the baby needs to have a procedure. So it's always good that you've got something there, and this will help relieve boredom, obviously, but make it fun and make it a positive experience for them as well, so that hopefully if they visit again, they'll be wanting to visit again. It's not like, oh no, I don't want to have to go there again. Daily diaries are really good as well. So it could be that a little written diary that you do, or it could even be like a little video diary, and it could just be a few little minutes of the things that happened in the baby's day. And it could be something that you send to whoever they're staying with, or it could even be that it's something that when they come to visit the baby, you can sit, and it's a little activity that you can do to help bond as well. And then also as well, the sibling, a good idea is to make for them to make a daily diary for the baby. So while they're at nanny and granddad's, or if they're going to school, or they might have gone on a day out, they can then write about their experiences, and then they'll be able to come into the hospital and tell you and baby all about it. And obviously if they can't come into the hospital, then it's having videos, making the videos, or kind of having little chats with them on the phone, a video call, and showing them baby and where they are, and making them see that you're okay and you're there with them. So I just want you to remember that you're not going through this on your own, and please ask advice and speak to the health professionals, but also the play specialists, because it is a way of that we can help to support them. And like we said before in the video, one of the ladies said in the video, I use siblings as the baby gets older. I use sibling lots and lots in the care, because children will come to me who don't like to have like echoes and ECGs. They might be being prepared for surgery, and I always say to families, it's always important to get the siblings involved so they can come and hear that preparation as well. And sometimes I'll also use them as a way of showing them, oh, it's not something to be scared of, because most of the time the siblings are happy to help. They'll be getting onto the beds and letting me role play kind of an echo scan or an ECG. So it's things like that that can get them involved as well. And I hope you found this useful. Thank you for listening, and this is just my details in case you ever want to contact me and ask any questions. Thank you.
It's absolutely brilliant, Lorna. Thank you so much. There was so many tips and hints put into that. I really hope you everyone found that really interesting. If you've got any questions for Lorna, then do put them in the Q&A or the chat, and we'll come back to them at the end. I'll just give a big up to Play Therapist. I don't know how we would have got through half of the appointments that we got through with Zoe without play specialists. They're absolutely worth their weight in gold. The fear of the unknown was something within that talk that really resonated with me. Zoe had some subsequent surgery. It was non-cardiac. She had some hip surgery when she was a bit older. And I remember taking one of her younger brothers, Max, to the hospital. And it was probably the first time he'd ever been to hospital, and he didn't know what it was like. He didn't know what to expect. As soon as he went in and he saw there were pictures of elephants on the walls and giraffes and all this sort of stuff, he absolutely loved it. And it just took out a lot of that fear of the unknown. So I think that was a bit that resonated with me, to just keep that talking to your children, find out what they're worried about, because it might be something completely unexpected. Little minds work in mysterious ways sometimes, and it might be that they were concerned about something completely unexpected that you can very easily talk to them about. But that was brilliant. Thank you very much, Lorna. So now, as you can see, it's over to Jill next for her talk. So I'll leave you to it, Jill.
So hello everybody. So like John said, my name is Jill McBurney. I'm one of the cardiac nurse specialists at Alder Hey. I've been there for a very long time now. So I've had a lot of experience talking to families, talking to siblings, dealing with all kinds of situations, obviously, in my job. So what I was going to talk to you is a bit similar to what Lorna's going to talk about, but from maybe more of a nurse specialist slant. So, oh, sorry, I've gone right to the very end there. I don't know how I did that. So one of the things when I was asked to do this, I thought about a few scenarios that we know that families have to prepare children for if it's them, or really to prepare siblings for if their brother or sister is going to be having a procedure, or if they're having a new baby and you already know antenatally that there's going to be a heart problem and baby may need to spend some time in hospital early on, or come home and come back in to hospital when they're a little bit older. And then a big part, I think, about talking to siblings is changes. Things happen when you come into hospital. Things happen when you come into hospital and they get cancelled. Maybe you come in for a hospital appointment and the siblings are present or they're not present, and you need to update everybody. A big thing that we know we talk about with siblings a lot is a change in condition. So that could be that babies or children or their condition has deteriorated a little bit clinically, and you need to kind of share that information. That could be quite a scary conversation to think about having. And again, we'll keep saying this all night, is that you're not on your own when you do any of this. We're always here to help you do any of that. And then I think a few people have already said today about a new normal. And I think these changing in life plans, that we were planning to do this, but we couldn't do it. And one of the mums on that clip before said it was the start of the summer holidays, so they probably had 6 weeks of plans already for have a lovely summer holiday, and then suddenly the new baby that's arrived, which is very exciting, is now actually in hospital and spending most of their siblings' summer holidays actually in a hospital setting. So I think, like Lorna touched on, I think different ages of children need different types of information. And so very young children, we tend to use picture books, we talk to them, we show them things. So I think when you have young siblings and their older sibling is maybe having subsequent surgery, maybe not having just one surgery, they're having other surgery, looking at photographs of when that sibling was actually a baby and in hospital. I think picture books are really, really good. So Usborne do great books about first experiences of all types of experiences that children have in their life. And obviously most of our parent groups do really good information for children. So at Tiny Tickers, we've just put together, well, myself and Tiny Tickers have put together a book about having a new baby, which is here, which you can see the little thing on the screen there. But one of the nice things in this is what Lorna was alluding to, is in the back of this book, which is a story book about having a sibling, we've also got some little activities and a little page that you can draw some pictures on. And the very last page is a certificate to be a big brother or a big sister, which is really, really nice. And then I think, like we've already alluded to it a number of times, is about play. Very young children learn about life mostly through role play and play and things that they see. So using their own toys as patients, I think having hospital play, things to play with. So this person's a doctor and this person's a nurse and this person's the person doing the scan and this is me and this is my big brother, and playing and talking about what's going to happen, whatever that is going to come, whether it's just a hospital appointment, whether it's coming in for an operation, whether it's that the sibling could be in hospital just for a few days. It could be that the child is coming in for an operation where they could be in for several weeks. And obviously, as we know, some cardiac children, when they have an operation, they're actually in for several months, and so their siblings are actually separated from them for several months. So older children, photographs again, but talking about what do they understand. Now, some siblings have a lived experience of being in hospital, either themselves because they've had something done, or they've been to A&E, or they've been to see granny, or they've been to see grandpa, or they've been to see somebody in a hospital, so they know what a hospital is. But like John was saying before, when he took Zoe's brother in to see the hospital, he'd never set foot in a hospital. And when we talk to children and siblings about coming into a hospital and coming into a ward, we always say, well, a ward's just basically a big bedroom. It's just where everybody sleeps when their children or the patients are actually in a hospital setting. But some children have got no idea what a hospital is. So I think using booklets and photographs and diagrams and drawings and whatever you would want to use, video clips and things on YouTube, lovely things that parent groups do for siblings and children all of the time, is a really good place to start, because actually having that conversation can feel quite daunting if you feel like you're on your own in your house doing that. But it's actually quite nice having a book as a starting off point, which is quite handy. And then I think much older children or teenagers need much more practical clinical information, probably quite similar to what you would have as a parent. Maybe not the nitty-gritty of the risks and the discussions that you have about doing procedures and the risks involved in that, but sometimes that is appropriate, and sometimes they will be asking you questions. And one of the things we talk about a lot is that I think if children are asking you a question, they need to have an answer. Now, it might not be the ins and outs of everything that's going on, but they need to have an answer about their sibling and what's going on and what's the doctor said and what's happening and what do they look like when they come into hospital. And I think the other big thing from teenage point of view, and really probably some older children point of view as well, is what are they already reading that you're completely unaware of. So age appropriate stuff online, age appropriate stuff on managing what they're reading online. So one of the things we always say to parents is, please go on Google and please look and please read all of this wonderful information that's out there, but just read some things with a little bit of somebody on your shoulder just talking to you saying, just be careful what you're reading, just be careful what you're reading. So when you have teenagers where they are the siblings of the child having the operation or the baby having an operation or spending some time in hospital, just be wary and opening a conversation about what have you read, and is there anything that you're particularly scared or worried about your brother or sister coming into hospital. And I think the most important thing of this is that you know your children better than anybody. You know your own family's lived experience in hospital, out of hospital, whatever that experience might be. So you know how to gauge all of that information, because you gauge that information to your children every day of their lives. So just know that you are the expert in all of your children. So you'll know where to gauge this, or how to aim, or how to start a conversation with them. So having the conversation, some families would choose to have a family meeting, actually talk to everybody at the same time. Some families would choose to have a bit of an individual conversation. Maybe one of my friends always says that her children choose the fact that when they're on the way home from school, or they're on the way home from a supermarket and she's in a car and she can't get out, that's the time that the siblings start asking questions, because that's when their brain is just engaged with what's going on and they're thinking about things, and they choose a time. So you need a bit of preparation and a little bit of thought about what you actually want to be talking about and what you want them to know about and how you're going to manage that situation. So I've put in the bottom of there about if children are old enough to ask a question, they're old enough to get an answer. And like I said, it might not be the nitty gritty that you get as parents, but they need to have some information. It's important that we don't hide anything from siblings, that they are aware of what's going on. And sometimes bite-sized information. So you might talk about things and then just leave it and just let them and think about it and sit with that information for a while, and then slowly might come back to you and ask you some more questions or want a little bit more information. And like I said, use the props and the books and photographs to guide you, to help guide you, have the conversation about siblings and their heart condition, and if they're going to come into hospital, and we're going to clinic next week and wonder what they're going to say and how we're going to manage that situation. But what I would say is, saying all that, is don't underestimate how that can make you feel. And everybody in that clip at the beginning talked about parental guilt and feeling awful and dreadful and thinking, how on earth are we going to kind of manage what's going on with our family at the moment? But that if you're feeling overwhelmed, if you're feeling very stressed or very scared and don't know how to start having that conversation, just remember we're all at the other end of a phone. So everybody that belongs to a cardiac unit has a team of cardiac nurse specialists. Most cardiac units have psychologists. Most cardiac units have play specialists. You have a wider family of friends that can help you. So don't feel that you're completely on your own having this conversation. And often as a healthcare professional, like Lorna said, I'm asked to talk to families and talk to children, but also include their siblings and talk to their siblings about what's going on. And sometimes we're the people that break that news, we're the people that have that conversation with the sibling if parents feel that they can't, or they're just not sure how to start that conversation. And it does take a village. This is all of us, family, friends, school, activity groups. So it's important that in a child's life, the people who look after them or the people that spend time with them, which is primarily childcare people, the family's friends that help you with your childcare, and particularly school, it's important to give them some information about not necessarily not the nitty-gritty of what's going on with the child or the baby in question, but actually about the situation at hand, so they can just keep an eye on the siblings and how they're doing, and you might give them a little bit of an extra watch and an extra looking after, just to see are they okay with what's going on. But again, that has to be that you're comfortable to share some information, some very private, sensitive information about your family. So managing separation. So I think this is kind of all families for coming into hospital or for any reason, whether it's heart surgery or any type of hospital stay, is how you manage all kind of being separate. Now, where a lot of people live in the country, if their child needs to have an operation or an operation, they might be quite close to home. But obviously, cardiac surgery is a little bit different than that. Cardiac procedures are a little bit different than that, and that you would obviously be a little bit far away from home. So we have a lot of families who live fairly local to Alderhay or fairly local to the cardiac surgical centre, so they're not travelling too far. But obviously we have families who are travelling 100, 120 miles to go to a cardiac centre. So thinking, if you've got time, is to kind of think about how you're going to manage being separated. So if you have an antenatal diagnosis or you've got planned surgery or a planned admission coming up, it's a little bit easier to do this because you have some time. But if you're managing this situation in an emergency, you can still do all of it, but it's just done probably more bluntly and a little bit more quickly. So similar to what Lorna has said, what we talk about from kind of managing that situation to involve siblings, because siblings are in one place, and the children, and quite often both parents or all of the parents, whoever they might be, are actually in the hospital. So thinking about FaceTiming, can we get siblings in to visit as well? Pictures, paintings, cards, decorations for the room. Most hospitals, most paediatric units are quite happy for the walls and things to be covered in all kinds of paintings and pictures and decorations. We're quite happy with all of that. But I think prolonged stays in hospital, probably think about, can you spend some time away from the hospital, actually with the siblings on their own? Can you go home for a night? Could you go home for a day? Could you spend, when the siblings come into the hospital to see their sibling and spend some time with them, actually, could you spend some time away from the ward with the sibling that's actually going to have to head off back home again fairly shortly? And then think about jobs, roles for older children and teenagers. Is there something that they could be doing? Are there some chores that they could be doing to help out? Are there little tiny things that they could do to help out? Like Lorna was saying, can they go and fetch you a nappy? Can they go and fetch you this? Can they have a little role within the family when they're at home that they wouldn't normally do? And that will be quite helpful, kind of include them in the kind of the situation that's going on at the moment. So, excuse me, professional support. I said, speak to your cardiac nurse specialist. Can we have sessions with the cardiac nurse specialist, the play specialist, the psychologist? And then think about what's available locally. So a lot of our heart children, when they're at home, are under the care of a community nursing team. They would be able to advise what else might be in the area from a sibling support point of view. Think about you talking to your local authority or looking at your local authority online to see, do they have any sibling groups, parent groups, anything really kind of to help kind of think about giving them a bit of a space to think about what's going on and give them some extra support. Also family support groups. Obviously most cardiac centres in the country have a parent group, which would be a great place to start for siblings to meet either other children that have got heart conditions, but also to meet other siblings of children who've got heart conditions, and to realise that again they're not on their own. There's lots and lots of other children out there in the country that are like them. They've got a brother or a sister that was born with a heart condition, that spent a lot of time in hospital, or has a heart condition, is going to go into hospital when they're a little bit older. And then again, involve them with the visits. So when we do pre-op visits, and I do antenatal visits and things at Alder Hey, one of the things we'd always say is, do you want to bring anybody else? And this isn't just siblings, this is families as well. But would you want to bring granny? Would you like to bring big brother? Would you like to bring little brother and sister? And just so they're kind of involved with what's going on, they can come and look and see, what does a ward look like? Where is their brother or sister going to be? So what I thought is I'll give you a couple of examples that have happened with me in the last couple of months. So I work very much with the antenatal service now. So we've recently had a family that have got a couple of children under the age of 5. They've got 3 children under the age of 5, and they're going to have a baby with a heart condition. They don't live very far away from Alder Hey, so they can probably come back and forth fairly easily. So we've used booklets from Tiny Tickers, Little Hearts Matter. We've done hospital play, and they've come for their visit to have a little wander around Alder Hey. And they've also been, this family have actually been to the neonatal unit in the women's as well, with the brother and sister, to have a little look around. And then one of the other families I've been involved with lately is a teenager who had an operation when he was very, very small, and he's going to come in and have another operation. And we've actually brought his 21-year-old sibling in to have a little look around as well. So she, even though she's really an adult, she's wanted to come and be involved, and she's sat in with consent when we discussed the surgery. She's gone through everything with him, so she said she wants to be able to be there for him, to help him in those times when mum might be at work and he just wants a little bit of to talk about things, that so she knows what's going on. I mean, and she's an adult herself. And then our third family recently is a child who's having their 3rd surgery. So for them and their big brother, we've looked at photographs of the patient having the operation. We've looked at photographs from when he was a baby that the sibling actually remembers, and we've talked about all of that. What was it like when he was in, and did you come and stay, and what did you buy him, and what did you get, and who did you stay with when mummy and daddy were in hospital? So it's kind of a whole gamut of situations that we can deal with. But it's, as I said, it's not just down to you. We're all here to help you, help your children, and help your children's siblings kind of get to grips with what's going on and manage any of the situations that crop up. So these are some of the resources that we tend to use. Tiny Tickers, Little Hearts Matter is probably who we go to most of all. Children's Heart Federation, British Heart Foundation. And then the very bottom of that, the Gosh clip, is actually a clip that the antenatal service did at Great Ormond Street about a baby having a heart operation when they're a neonate. And it's just talks about the unit, but actually shows you some video clips of babies when they've had an operation, so they know kind of what they're going to be walking into if they're going to visit, particularly if they're going to visit intensive care. And that's it. Thank you very much.
Brilliant. Thank you so much for that, Jill. Again, absolutely packed with loads of information. That Gosh clip I was watching that earlier today, and it's really useful. We'll make sure that that is linked in the email that we send out to all the attendees after the webinar, so that everyone can click on that and have a look at it. The overriding thing that came through there is don't go through this alone. There's professionals out there to support. There's loads of charities offering support.
Yeah.
You did a fabulous job, may I say, of selling our sibling support booklet by holding it up and showing some of the content. Thank you for that. But that's a free booklet that anyone can order from Tiny Tickers by just dropping us an email at orders@tinytickers.org, or just jumping on social media and asking us for a copy. We'll send that out. We've got a family support group on Facebook that's got a few thousand people on there, so it's a place where people will ask questions and get loads of peer support. So I think that overriding message of don't go through it alone is what jumped out at me, and the fact that a lot of these conversations happens in car journeys. That was the other thing from my experience. All the big conversations with
Happen in the car.
car journeys. Brilliant. But thank you so much again for that, Jill. So now I'm going to hand over to Rachel to talk about the emotion. This is from an emotional well-being side, I guess, Rachel.
Yeah, that's right, John. And thanks Jill, and thanks Lorna. That was yeah, you covered loads of wonderful stuff there. So I'll try and add to that. So I was going to share, so yeah, I'm Rachel, a clinical psychologist at Leeds, and I wanted to share that I guess caring for your child with congenital heart disease is undoubtedly more challenging when you have another child or children who need your love and your care and your time. So remember that it feels harder because it is harder. And as a result, you'll naturally feel the psychological burden of guilt and feelings of distress and overwhelm, trying to split your time between your family members and your children, your child in hospital and your child at home. And I think it's really important to hold on to the reality being that it's impossible to meet everybody's needs all of the time. And I see so many parents at the hospital in Leeds who put huge pressure on their shoulders to be kind of this wonderful, amazing, perfect parent, and you really don't have to be. So some things that are really helpful to know. So number one, children are hardwired, evolved to be able to adapt and adjust to life's challenges. And we have to kind of hold on to this, because while children go through a range of normal human emotions and feelings, when they're faced with something they either perceive to be stressful or that they experience as stressful, we have to remember they're extremely resilient, and they can and do get through really difficult phases of turbulence. Sometimes what we do as parents, I'm guilty of this myself, we struggle with situations and then think, yeah, this is going to be really hard for them. What must they be thinking and feeling? But it's important to hold on to. Children are very black and white in their thinking. So sometimes when they're busy at school, and Jill and Laura have talked about the importance of routine, but sometimes when they're busy at school, that's their focus. And we might be thinking, how are they getting through their day? I've cried 5 times before 9 a.m. And actually they don't hold on to our kind of complexity of thinking and our cognition. So it's important to remember they're children, they're hardwired for struggle, and they can and do beautifully get through periods of difficulty. But what makes those periods of difficulty smoother is when we are kind of good enough parents. We don't have to be perfect, like I said earlier, but it's being good enough and trying our best to lessen the impact of what they're going through with their baby brother or sister. So I guess children's cognitive and emotional development does play a part in how they make sense of what's going on. You know, what's happened to my baby brother or sister, and why do they need additional care? But regardless of age or ability level, it's important to remember that children of all ages, and as I was writing this, I was thinking, and adults too, use care-seeking behaviours to kind of really hook you in and bring you in at times of vulnerability. So it's not attention-seeking, it's not kind of watch this, this is care-seeking. So it's, I'm unsure with what's going on, the world feels a bit scary, and I'm trying to bring you close for reassurance, comfort and care. And there are quite a lot of care-seeking behaviours that you might see in your children. So I thought I'd run through a few of these, and you might be listening thinking, yeah, that's us, that's my son or daughter. But toddlers, so young children tend to become a bit more fussy or clingy if you've had a period of absence and then come back. And it's them trying to communicate, I want you, I need you. They might be wanting to be held more, carried more. You might see that they have huge back peaks in their separation anxiety, in that you leave the room just to go to the bathroom and they're crying and inconsolable. And that's really normal. They may act out, they might have anger outbursts or some big, almost really big meltdowns. And again, they're just overwhelmed that you're here, and they kind of can't make sense and they can't verbalize what's going on. And as mentioned, this is all really normal things. And children exhibiting these care-seeking behaviours, it's not damaging, it's a normal human behaviour, something we all do. So they're just things to be looking out for, and then I'll move on to kind of how we respond to these. Preschool and younger children, again, all of the behaviours described above, but they can also say things like, I feel unwell too. Young children are very good at copying and mimicking to kind of get that care. They may have seen their baby brother or younger sibling or older sibling get a lot of care and time and your closeness through their illness. So they may try and emulate that too, and say, my tummy hurts, my head hurts. They tend to be common ones. And it can be genuine. We never sort of disregard that. If a child's saying, I don't feel very good, usually it's that they're feeling uneasy. But they might have a stress headache or an uncomfortable, churny, nervous tummy. So we never sort of disregard this as you're fine, you're fine. It's important that we hear what they're saying to us, and remember this is a kind of they're trying to bring me in and bring me close. You may also see regressions. A lot of parents I speak to say, oh, my 5-year-old's using this baby voice and they're really articulate. And again, it's that they're stepping backwards to kind of go, I need you, I'm trying to do, it's a subconscious survival behaviour to bring you close. Older children, we know that they're really good at actually telling you how they feel. Like we said earlier, those car conversations where you're kind of locked in with them and they might ask these big questions. And they might say, I'm missing you if you've been at the hospital, or where are you going, or what's going on? And they might ask those big questions. But you might also see some care-seeking behaviours through a bit of withdrawal or sadness or feelings of anxiety. And sometimes, again, those feelings can manifest in physiological ways. So they might say, my head aches, my tummy aches. And they're just things to be looking out for. But it's really important to remember that managing big feelings in your child, it's not really about being responsible to take them away. And that's probably quite hard to hear, because as a parent, you think, I've got to make this all okay for all my children. But our job as a good enough parent is to hear it, to listen, to make the time to listen, and to validate those feelings by saying, of course you're going to feel like that. This is hard. And you can say, I feel that too. I feel sad that your baby brother's not coming home, and this is really, really hard. So you can be aligned with them and validate all their feelings. You can also normalize them and say, of course it's normal you're going to feel a churned up tummy. We're really uncertain, aren't we? And things are really, really difficult. And name some of the feelings that you're experiencing to help them with that emotional literacy. The aim, I guess, as a good enough parent is to create a sense of psychological safety. It's a bit of a big term for basically saying how we soothe and calm and I guess nurture our children through these periods of turbulence. And so here are some top tips, and they've been mentioned before, so I won't dwell on them, but just to reiterate the great words of Lorna and Jill, but routine, that's my number one thing, and the number one thing that I say to so many parents at work. You're trying to encourage your child at home to live as normally as possible in the face of all this kind of difficulty and adversity. And remember, they don't hold on to all the feelings and worries and pressures that we hold on to. So keep nap times, bedtimes, meal times consistent. Do take your child to nursery or school if you're able to keep that routine going. I think it's really important, to maintain boundaries as well. We do sometimes see children pushing those boundaries because they're care seeking, they're trying to bring you in. And it's okay to say to you young people, anger's okay, sorry, children, anger's okay, and these feelings of overwhelm and these outbursts, I understand what that's about. I'm here and I'm with you. However, it's not okay to hit out. It's not okay to smash that. And so keep those boundaries really, really firm. And again, Lorna said it, children love that routine and they love to know that the boundaries are still there. Contact is my second sort of top tip. If you can, up the contact, and that's really hard when you're torn, like I said earlier, you're torn between hospital and home or appointments and home. But that contact doesn't have to be a full day. So what we know is that children really love undivided one-to-one, but that can be as little as 15 minutes of golden time. So saying, you choose your favorite books and we'll snuggle up and read them. What would you like to do today? What would you like to play today? It can be before you drop your child at school or preschool or nursery. I know the mornings are incredibly busy, but just creating a tiny little bit of space for them to say, I'm here, I'm with you. What would you like to do? And mummy or daddy is listening. So the one-to-one's really key if you can get it. If you can't and you're in the hospital, and we appreciate people sometimes miles and miles from home, but to take some time off the ward, to find a little quiet space and to video call your child, it just at home, it just helps them feel held in mind when we're still thinking of me, daddy's made the call. So yeah, schedule a little bit of time. If that time's predictable, that can help too. So you can say, I'll ring you at bedtime, or we'll read a bedtime story together. Give your children, the siblings, age-appropriate information. How we as psychologists start this, and how we encourage families to start these conversations if they haven't asked any questions, is to ask them and say, what do you think's going on? Why do you think mummy's been at the hospital for this many days? Or what do you understand by why your baby brother or sister's in hospital? Because if you ask them, then you can kind of get their understanding and build on that. Some children will say, I don't know, and then they'll run off playing, but that's a really clear cue. They're not that interested, and that's us kind of putting on them. So we're trying to be child-led and led by your child. So ask them, it's okay to ask. It might be an older child that opens up some really big questions and uncertainties and anxieties, but there is no need to bluff. We don't have to give all answers, and it's okay to say, I don't know when your baby brother's or sister's coming home. I can't tell you that. Or I don't know how to answer that, but we'll ask staff at the hospital. And Jill said it and Lorna said it, but there's psychologists on the units. There are play specialists, there are clinical nurse specialists with the expertise to talk to children. So we can do that for you if you feel like you're completely out of your depth, and that's okay. The language is technical, isn't it? I'm still learning a lot of it, so to bring that across is hard. But what you can do is use play, toys, dolls, little medical sets. You can draw out what you think's happening. You can draw a picture of a heart and some rough ideas of what's going on. And again, be led by your child. If they get up and walk away, they're probably not that engaged, not interested in listening. But if they ask a question, we always say, please give an honest answer. But yeah, don't feel you've got to bluff. The Tiny Tickers website is fantastic, and Jill's mentioned it already beautifully, but the Our Heart Baby book is just lovely, and I would really encourage you to have a look at that if you can. Great puzzles, activities, things you can do with your child while you're at home with them. Try and include your child as much as possible in everything. So I think it was mentioned before, but if you can encourage hospital visiting, that's great. If you can't, or they're too little, or they won't understand, they might want to draw a picture, or they might want to, some children in the hospital in Leeds have recorded little messages, little voice notes, like, hope you get well soon. And it's making them feel like they're doing something, and it's bridging the siblings together. So they're, again, both held in mind. All feelings are valid. It's really important to remember that. So you don't have to be superhuman. You don't have to be robotic in how you cope with what you're going through. You sometimes can't, and it comes across disingenuous. So you have to be true to yourself. If you're tearful, and it's okay to say, I'm having a bad day today. Mummy or daddy, we're feeling sad today, and explain what that's about. It feels very hard because it is hard. And I think sugarcoating things or being sort of unusually jolly or jovial, yeah, older children particularly, they can see right through that. So allow yourself to feel and be upset, I guess, and that can be really hard. I sometimes think we grow up in a bit of a culture of must protect our children from everything, but actually when you say show your emotion and share how you feel, you're opening the gates to say, and how do you feel? Let's talk about this openly as a family rather than shutting it down. And again, naming feelings is great. You can start naming feelings from as little as having a toddler, because it's great for emotional literacy. Equally, it's okay to laugh as a family, make time for fun, have jokes, tickle, play. It's okay. Like, allow yourself to have that fun. It doesn't always have to be super serious and super sad. And then my last kind of top tip is it's really important to take care of you. There's a bit of a saying in our profession, but you can't pour from an empty cup. And that means you can't give, your love and your time and your care when you're feeling completely burnt out and at your wit's end with sadness and worry and overwhelm. So do take care of yourself, and in whatever means that is. You probably won't have the energy to be parenting and looking after toddlers and young children and doing homework when you get back from hospital visits, but there's no such thing as a perfect parent. It doesn't exist. It's been good enough. And you can tap out, you can say, we won't do that today, and I'm tired. And children understand, and they're very, very empathic to that. And don't hesitate to delegate tasks to family members if they can help. Pull in everybody you can, because you need that time. And the last thing before I finish is Tiny Tickers offers some fantastic peer support groups. And I know John might mention this, but there's a peer support session online, which I'll be running. So it's Tuesday, the 8th of October at 8 p.m. You're welcome to come in. Just if you're interested, let us know. It's advertised on social media, and you can come and talk with other heart parents about your worries for your siblings, how you're managing the hospital, home routine, anything you want to talk about. And the sessions last for an hour, and it's a safe, confidential space for you. There's also the same theme on Friday the 18th of October, but the time is at 11:30, so it's a lunchtime session. So for those of you that can kind of dip out of work or caring responsibilities, do come along to that. And that's a really informal, we call it a cuppa and a chat. But yeah, bring a cuppa, come and have a chat, and don't run your own with these huge thoughts and feelings. That's everything. Thanks, John.
Brilliant. Thank you, Rachel. That was absolutely superb. And thank you for the plug for those support sessions at the end. I would thoroughly recommend them, though. Rachel does fantastic support sessions. The information about how to sign up for those is in the chat, and we'll put that out on the email after the webinar as well. And obviously, if you're watching this in a few months' time later, due to the power of the internet, there'll be other support sessions all going on all the time. We've got loads of them going on all sorts of different topics, so just check on our website or our social media and you'll find those. I love the fact that you looped it around at the end, Rachel, to that concept of good enough parenting. And I think we do put a lot of pressure on ourselves, don't we? And I think also it's worth just pointing people to the webinar that we've already done in this series on parental and carer mental health and well-being as well, because then that leads into looking after yourself and being in the best place to look after your family subsequently to that. And also the other two things I wrote down there are what you were saying about how resilient children are. I think we do underestimate that sometimes. And that whole concept of just being led by them, which I think has been a recurring theme, hasn't it? Throughout the evening, being led by them into how much information, what questions, what we want to be telling them. But that was absolutely superb. Thank you. Just mentioning on the support groups as well, we are talking about doing one for single parents, because I guess there's additional pressures there if you're juggling this yourself, if you don't have that big support network as well. So if there is the interest in doing some on single parents, we will be doing that as well. So keep an eye out for that. I'll ask Lorna and Jill to come back in. I've seen one question which we can go through. If anybody else has got any questions they want to ask, then do please pop them up on onto the Q&A or onto the chat. The specific question we got, I'm not sure who wants to jump in on this one first. It says, I've got a nearly 6-year-old heart healthy child and a 1-year-old heart warrior. The older child, so the 6-year-old, is struggling to express their emotions around their brother's condition, which is hypoplastic left heart syndrome. He fears his brother is attending appointments. He fears his brother attending appointments in case he doesn't come home. So please, can you advise how to help reduce that? Not sure who wants to jump in there first. Jill, I can see you nodding, so maybe I'll throw to you first.
Okay, I think it's really tough, isn't it? I think all of what we've been talking about tonight has been about this, is how do we help them? How do we get them to kind of live through this experience and be okay? And it's okay for him to be, in some ways it's okay that he's feeling, I'm saying he, did we say a brother? Yeah. Is it's okay that he's a bit scared, and obviously for him he's just experienced a baby being born, and I imagine spending quite a few months or weeks in hospital at the beginning and then going back into hospital for the stage 2 to be done. I imagine that's what's happened, so I can appreciate that he probably is a little bit scared and probably feels that that's what it's always going to be like. Is this baby always going to be going back into hospital? So probably what I'd say is start by is having a little chat about what is he scared of, and why is he scared of that particular thing? What is it that's made him think that his brother's not going to come home from the clinic appointment? And kind of start from there, and then just kind of build on that and think about what does he remember about his brother being in hospital? Now, if he's experiencing or listening and hearing the adults in the family have a conversation, maybe in the kitchen, and not realizing that he's listening, and think about what has he heard, what is it that's made him scared, what is it that's kind of, and then you can kind of think about, all right, well, how do I reassure him that that's not the case, that we would expect a little one to come home from clinic pretty much every time they go to clinic. We can't promise that that will happen forever. And obviously there could be a conversation down the line that is a little bit different than the conversation saying they're going to come home. What is it that you're worried about? They're going to go to clinic. We're just seeing the doctor. It's just to do a scan and look at his medicines and make some little changes and things. So I would say start with what is it that he's scared of, and then kind of build on that. But it could be that he needs a bit of time to think about what he's actually just experienced over the the past year since the new baby arrived.
Brilliant, thank you, Jill. And would Rachel or Lorna, is there anything you want to add to that? That felt like a very full answer to me, and an excellent answer. Rachel, do you want to come in?
Yeah, I was just hearing that and thinking it sounds like a tour of the hospital would be so helpful. So when I was saying about including, I know he might have school, but if you can just see, sometimes children build up pictures of what this hospital is going to be like. You may imagine it to be quite a scary, threatening place with like lots going on. But if you can come with his baby brother, have a look round, meet some of the staff, see that they're friendly, jovial people, that there's a playroom on the ward, that there's there's stickers, there's rewards, there's treats. The dinners are nice. I think it's sometimes building or reframing the picture of hospital. He might be sort of thinking, yeah, understandably, about missing mummy and daddy, and they're suddenly not there when I wake up. And you're right, Jill, it's talking about that with him, what he's frightened of. But if he's up for it, taking him to the hospital and showing him around and saying, when we come for our clinic appointment, this is where we are, and he'll see the waiting room, so he can visualize it a little bit, and it maybe breaks down some of those fears for him about something horrible going to happen. And just that reassurance that when he's here, when your baby brother's here, he's safe. And it might be that we're not back for bedtime, or we're away, but someone will always look after you, and that reassurance there is always going to be a grown-up who's going to look after you. You're safe, we love you, and you're in really safe hands. So yeah, loads of reassurance.
Brilliant, thank you. And Lorna, I'm sure you'd echo all of that.
Yeah, to be honest, that was what I was going to say. If they can do, to be involved in the visits, just to kind of reassure them and they can see what's happening. Like maybe, go through and they can see them having their echo scan, having their ECG, being, having height and weight, and maybe even seeing if they could be involved as well in a little bit of that too. And I always say about parents, taking photographs as well when they visit clinics, so that they can always use it with the heart child to kind of, because sometimes there's a big delay in visits to the hospital for clinic, so sometimes it's for a child that time's a long time. So I always say take photographs to kind of remind the heart child, but they could always use that with the sibling as well to show them that, look, this is what they do when they go to clinic and things too. So yeah.
Brilliant, thank you very much. That's the only question we got coming. I've seen there's a comment on the chat about some interest in doing a webinar or sessions focused around single parents. So we will follow that up, and we'll look into seeing what we can put on there. So thank you very much, everyone. I'm just going to put a little poll up, which is a feedback poll, if I can work out how to pop it up there. I'm not sure. Hopefully people can see that on screen. I'm not sure if it's come up actually. But let's see, here we go. How do I launch it? There we go, it is launched. So hopefully you can see that on screen. If not, I'm going to get a message saying we can't see it on screen, so the poll doesn't appear to be working. But we'll send out a feedback poll in our email afterwards. We're really grateful if you can respond to that poll, because it really helps us give some information to our funders about the support that they're giving us as a charity, and hopefully more funding for more webinars in the future, but also it helps us tailor what sessions we might be able to put on. So we'll pop that out into the email instead this time, if that's okay. I just want to say a massive thank you to the three of you. For me, that about an hour and 15 minutes of absolute gold there. There were so many practical tips, but coming at it from 3 different perspectives as well was just so interesting to listen to. And I'm sure it's been really, really reassuring for everyone who's listening, and also really practical as well. So thank you very much, Rachel, Jill, and Lorna. We've said a lot about the links to our books, the links to our sessions and different things like that. So yeah, please do go on and book onto sessions if you'd like to. We will do a follow-up email, which also has a fact sheet with a lot of the information that was included in the slides. And obviously you're going to get the link to a video of this webinar as well, so you'll be able to watch it back if there's any bits that you just want to go over again. Keep an eye out for the future webinars in this series. If you want to know more about our work, just visit our website at www.tinytickers.org or jump on and follow any of our social media channels. I should give another thank you out to Global Make Some Noise, who funded this webinar series. We're very grateful to them. And I think that's it, unless anyone's got any closing comments. I think we covered so much ground there. Thank you all very much indeed. Have a brilliant rest of your evening. And I hope you've taken some practical tips from the webinar tonight. Thank you all so much.